The reasons and causes of the sexual dysfunctions can be various. It depends on the various aspects of the human, like a person. Like it can be biological, it can be psychological, it can be a combination of biological, psychological and social difficulties. In cases where the biological causes are there, the most common biological causes are because of the constant or chronic uncontrolled diabetes, a constant and chronically uncontrolled hypertension, a chronic alcohol or tobacco abuse, use of illicit drugs, recurrent infections due to sexually transmitted diseases, can be because of uncontrolled or difficult hormonal like balances or imbalances, and like certain cases due to because of the like degeneration of the neuronal system which controls the sexual like activity of a person. In commonly seen psychological causes of sexual dysfunctions are the mood disorders, specifically the depression, the anxiety disorders, certain cases of obsessive compulsive disorders. In certain cases of in negative schizophrenia or certain like psychosis, psychotic illnesses in which the sexual desire comes down or sexual practices are not being performed by the person. In certain cases of the social situations, specifically the lack of the privacy, specifically in a populated country like ours, and in which there are small houses and there are many people living in a small house. The lack of the social lack of the privacy causes sexual dysfunction in many of the partners. In most of the cases, over the time, all these three becomes, they muddle up, and it gives a picture of a combination of biological, psychological, and the social aspect leading to the sexual dysfunction. Importantly, the sexual dysfunctions because of any of the reasons can be of majorly of two types. It may be a temporary sexual dysfunction, like which would take place for some time and it would vanish, and second is a kind of, it depends on the severity of the damages which have taken up because of the biological reason, specifically a kind of the permanent sexual dysfunctions. But fortunately, the most of the sexual dysfunction what we see in our clinical practice are reversible, are temporary, and definitely could be treated. Most importantly, a proper treatment should be like offered at the very early phases of the sexual dysfunction, because of the lack of sexual dysfunction or because of the sexual dysfunction. Many of the people, they start feeling low, they at times become suicidal, or they feel that their life is not worth living. So definitely an identification of the cause is very important in treating all the sexual dysfunctions.